Good morning and welcome to the unveiling of the United Nations Educational, Scientific, Cultural Organization's launch of the O3 Plus project. This live broadcast is brought to you by Zim Papers Television Network, ZTN, with the help of our partners, UNESCO. We are situated at the Diamond Hall at the University of Zimbabwe for this auspicious event, which we believe will be memorable. Now, what is the O3 Plus project? Well, this project aims to target young people in higher and tertiary education systems so that they can realize their positive health, educational, and gender equality outcomes. This will also help us combat things like mental health. It will also help us plan ahead and avoid early and unintended pregnancies and have safe environments and prevent gender-based violence. I'm now going to cross over to our Master of Ceremonies for this auspicious event, Dr. Shawa.
Permanent Secretary, Technical Services, Ministry of Education from the Republic of Zambia, Dr. Jacobs Kalumba, Vice Chancellor of the host institution, University of Zimbabwe, Professor Paul Mafumo, represented by Pro-VC, University of Zimbabwe, Professor Charles Mbowa, Vice Chancellors from project institutions in Zambia and Zimbabwe here present, college principals from project institutions in Zambia and Zimbabwe here present, the CEO, Zimbabwe Council of Higher Education, Professor K.P. Vimble, the CEO, National AIDS Council, Dr. Bernard Madzima, the Dean of Students present, senior government officials, representatives from the civil society organizations, students from Zambia and Zimbabwe here present, members of the press, all protocol observed, ladies and gentlemen. That was a mouthful. And I'll give permission to anyone who will come up to speak to kindly stand on this protocol. My name is Remy Shaw, and on my right is the sign language interpreter, Prisca Signora. You might think that I am an MC this morning. I am not the MC, I'm the program's director. There's a slight difference, and I'm happy to explain that. An MC is usually very funny, and they have jokes. I don't have any jokes. I'm a very serious guy. In fact, I was asked to do this job here not because of my jokes, but because of my looks. UNESCO looked at the whole of UNESCO in the region, and they asked themselves a question: who do we want to show up there in the front? Who is the most fine-looking gentleman we have in the organization? And my name came up uncontested. Well, also, you know, the good command of English I have, but mostly it's the looks. So I'm going to use this opportunity to see whether I should stay, you know, in UNESCO or maybe try comedy and, you know, this kind of thing, because it does feel good to stand here. So I wrote some jokes down, and based on how you laugh or not laugh, then I'll know whether I should keep my job or not. I mean, I looked at the guys like Trevor Noah. I mean, he's not even... I looked at guys like Trevor Noah, they're very funny, and, you know, I thought maybe I could pick one or two things. The first announcement I would like to make before we proceed is how to say my name correctly. It's Remy Shawa. For the Shonas in the house, it's not Remy, it's Remy. And it's not Shava, it's with a W, Shawa. After I met Shonas and how they say my name, I kind of understood why their parents named them very funny names. For example, that's the name. It's funny, here in Zimbabwe, last time we had the ICASA, I don't know if you remember the AIDS conference. We were at an event and, it was happening. There was this huge vibe. And then this gentleman in front turns back and looks at us, my colleague and I, and he says, "Hey, guys, I'm motivated." And then I was like, "Yeah, me too." And he says, "What's your last name then?" Then I realized I made a blunder. So my guy tells me, "No, that's his name, Motivated." But what's funny is that I kind of haven't met any minister or VIP with these names. Do you change when you go into office or not? All right, that's enough. I want to still be able to live here, so I'll be very nice to the host. Let me introduce the visiting universities and colleges as well. So I will call out the name of the institution, and if the vice chancellor or the college principal could just stand or wave, and then I'll ask the students also to do the same, so that we kind of know exactly who is in the room. Let me start with the host institutions. The University of Zimbabwe. University of Zimbabwe Vice Chancellor or representative, I think, and the students. Are there any University of Zimbabwe students in the house? There. All right. Let's give them a round of applause. Thank you for hosting us. Chinhoyi University of Technology, undergraduate. There. All right. And the students? All right. You're welcome. I know it's difficult to ululate in the masks, but could you try to just, make that African sound as we welcome? Yeah. Daniko Training Center. Yeah, see? I didn't see the students. Students, Daniko Training Center. They. Welcome. Great Zimbabwe University. Lovely. Harare Institute of Technology. Harare Polytechnic. Manicaland State University of Applied Sciences. Mutare Polytechnic. Mavingo Polytechnic. Thank you very much, ma'am. Mufure Industrial Training Center. National University of Science and Technology. There. Westgate Industrial Training Center. Welcome. I hope that's all, and I'll move on to Zambia. University of Zambia. The best university in the world. No doubt whatsoever. None. Kwame Nkrumah University. Kabwe University of Technology. KIC. Chalimbana University. Evelyn Horn College. Mulungushi University. Nkumbi International College. Northern Technical College. Lusaka Business and Technology College. Copperbelt University. Why was CBU very loud when I said University of Zambia is the best? Mukuba University. Technical and Vocational Teachers College. Thank you very much. So those are the institutions that are present here today, and thank you for joining us. At this moment, I would like for us to cruise forward in the program and invite the Vice Chancellor, University of Zimbabwe, Professor Charles Mboa, to come and give us some welcome remarks. A round of applause, please.
Thank you very much, Programs Director. I thought maybe you were called also Event Director. As you were speaking about your looks, I thought about 1963 and Nelson Mandela. So I hope those are your ambitions. The Honorable Minister of Public Service, Labor and Social Welfare, Professor Paul Mavima. Thank you, sir, for gracing this event. Also, on behalf of our Minister of Higher and Tertiary Education, Innovation, Science and Technology Development. The Honorable Minister of Education, Zambia, Honorable Douglas Siakalima, we thank you, sir, for crossing the border and coming for this event. We know that you are very new in a new government, and that, you know, we start the ball rolling with you well. Permanent Secretary, Minister of Higher and Tertiary Education, Innovation, Science and Technology Development, Professor Fanuel Tagwira. Permanent Secretary, Technical Services, Zambia Minister of Education, Yobix Kalumba. Your Excellencies here present, Ambassador of Sweden, Her Excellency Esther Person, Ambassador of Zambia, His Excellency Emmanuel Tawana Chenda, Swiss Agents for Development and Cooperation, Regional Director for Cooperation, Mr. Manuel Thunhofer, United Nations Resident Coordinator, Ms. Maria do Fale Ribeiro, UNESCO Regional Director and Representative, Professor Hubert Hessen. It's nice to meet you again, and thank you for the support. UNAIDS Country Director, Sophia Mkasa Moniko, the UN Family in Zimbabwe, Vice Chancellors from project institutions here present in Zambia and Zimbabwe, college principals from project institutions in Zambia and Zimbabwe, CEO, Zimbabwe Council for Higher Education, Professor Nzimbo, CEO, National AIDS Council, Dr. Bernard Mazima, Dean of Students, University of Zimbabwe, and other deans here present, senior government officials here present, representatives of civil organizations here present, students from Zambia and Zimbabwe here present. Ladies and gentlemen, allow me to first convey apologies from Professor Paul Mafumo, our Vice Chancellor, University of Zimbabwe, who is away outside the country on national duty. He would have wanted to be here, but it was physically impossible. Good morning, distinguished guests. Good morning, distinguished guests. Thank you for being awake. I would like to take this opportunity to welcome you to the University of Zimbabwe. Thank you for choosing the university to be the host of such a momentous event. It is greatly appreciated. The UNESCO O3+ program, which consists of our rights, our lives, our future, comes at an opportune time, considering the challenges faced by students at institutions of higher learning in Southern Africa and beyond. The challenges include, but are not limited to, gender inequality, gender-based violence, and unintended pregnancies, among many others. The COVID-19 pandemic has compounded some of these problems as well. The University of Zimbabwe has taken a strategic and deliberate approach inculcating the spirit of Hunu, Ubuntu. Some say Hunuism, some say Utu, in the students to deal with some of these challenges. So loosely translated, that's humanism, being part of humanity in its full context. This has seen an introduction of some campus-wide modules taught to all students at the University of Zimbabwe to deal with some of these social ills. I therefore applaud UNESCO for coming up with such a project to institutionalize health and well-being of the students while engaging leadership for long-term commitments and sustainability. Let me also take this opportunity to thank the generous support from the governments of Switzerland, Sweden, France, Norway, and Ireland for the O3+ program. Thank you for choosing Zimbabwe and our sister Republic of Zambia, here represented among other 8 African countries in this cohort. This support will go a long way in strengthening capacity of campus health facilities and offering a trusted standard package of youth-friendly health services to our students across all our universities and colleges. It is also my great pleasure to note that the program dovetails directly to the health, education, gender issues espoused in Zimbabwe's economic blueprint, National Development Strategy 1, NDS 1, as crafted by the government of Zimbabwe, Sustainable Development Agenda 2030, African Union's Agenda 2063, among many others. There are linkages and synergies between SDG 3 on health and well-being, SDG 4 on quality education, SDG 5 on gender equality, SDG 16 on peace, justice, and strong institutions. To this end, I welcome you all and hoping the program will shape attitudes, values, and skills for students required for a peaceful, tolerant, and inclusive society, free of sexual harassment, prejudice, abuse, and exploitation, among other social ills that can face different institutions of higher learning. This should enable students to reach their full educational potential and contribute to national development. I thank you.
Thank you very much, Pro Vice Chancellor, for those remarks and for welcoming us to this esteemed institution. At this moment, I'd like to invite Dr. Patricia Machawera, the Regional Advisor from UNESCO, to come and give us a short presentation on why we should focus on higher and tertiary education. A round of applause for Patricia. And please, you can stand on my protocol so that we try and catch up.
Thank you, Program Director. Allow me to say all protocols observed. My task this morning is to speak briefly about the status of sexual and reproductive health and rights for young people in tertiary institutions, focusing today on the two countries, Zambia and Zimbabwe. If you could, yes, thank you. So that is the outline of my presentation. Next slide, please. So since 2015, UNESCO had been engaged in discussions with a number of partners for support towards sexual and reproductive health programs in higher and tertiary education. But many were asking, why should we focus on students in higher and tertiary education? Surely by that age, they have all the information having passed through primary and secondary education. But the reality on the ground is that our higher and tertiary education institutions are home to a large number of sexually active young adults who are at risk of negative sexual and reproductive health outcomes, such as unintended pregnancies, sexually transmitted infections, mental health-related issues, which ultimately affect their career progression and life goals, thus limiting their potential for enjoying fruitful lives. It is frequently assumed that because students have reached the tertiary level of education, they have received the education that equips them to avoid the negative health outcomes. But we know that for our region, East and Southern Africa, the reality is that too many of our young people are still growing into adolescence and adulthood with very limited knowledge about their reproductive health and sexuality, as many will have missed it at basic education in a context of poor access to sexual and reproductive health services. So our argument is we can't focus our efforts on primary and secondary girls and boys only to have them become vulnerable to HIV and pregnancy right when they enter into higher and tertiary education institutions. So it's important for our work to focus on this critical transition period beyond secondary and the world of work. For young men as well, to support them to understand, analyze, and address toxic masculinities, issues of consent, respectful gender relations that can contribute to more equitable relationships and healthier lives. Next slide, please. So in 2020, the Swiss Agency for Development and Cooperation accepted our proposal after a number of years of engagement for a program called Our Rights, Our Lives, Our Future, focusing on the two countries, Zimbabwe and Zambia, and looking at 24 institutions that you had being welcomed this morning. So this work on the O3+, the plus shows that it builds on and extends on UNESCO's decade-long work through the O3 program, which focuses on support to basic education. So what the O3+ does is it extends that support to higher and tertiary education. And when we are talking about higher and tertiary education, we include universities, polytechnics, anything beyond secondary, so that we are really inclusive in addressing the higher and tertiary education sector. You'll see that in the institutions that were introduced this morning, there are also some who host students living with disability. So as part of the inception phase for the O3+ program, we commissioned a baseline survey and a health facility assessment to help us establish indicators prior to the start of the program. So these baseline documents which you see, which are already out, and we have copies available if you would like, track the key indicators that we'll be tracking through the life of the project to see if the project is making a difference to the lives of young people in the institutions. So in terms of the methodology approached for the baseline, we used a mixed method research design combining qualitative and quantitative methods, given that the program will be tracking both quantitative and qualitative data. Because of COVID restrictions, the research used both virtual and in-person approaches, and all 24 institutions in Zambia and Zimbabwe participated in the study. Next slide, please. So separately, we also conducted a health facility assessment, and the data was largely collected from the campus-based health facilities, we had in-depth interviews with key stakeholders, healthcare providers, young people, with at least 96 interviews conducted in Zambia and 36 in Zimbabwe. So I'll just go quickly to the findings in the interests of time. So in terms of the demographic and social characteristics of the students surveyed, data was collected from a total of 3,751 students. Majority of the students were single. More students were staying on campus in Zambia than in Zimbabwe, as we can see on the slide. In Zambia, we had 60% of students staying on campus, and than in Zimbabwe, where we had 21%. In terms of the policy environment, next slide, please. The baseline found that the policy environment for the provision of adolescent sexual and reproductive health is favorable in both countries. Both countries have policies that regulate provision of sexuality education and youth-friendly services for young people. A number of key policies do mention this. For example, the Zimbabwe National AIDS Strategic Plan and the National Health Policy and Strategic Plan for Zambia, just to mention a few. So, next slide, please. New HIV infections. So the baseline sought to establish the number of students aged 20 to 24 who have been tested for HIV. So as you can see on that slide, the low percentage of students tested for HIV is consistent with low risk perception to HIV amongst this group, meaning that the students don't see themselves to be at risk of HIV. So considering that, if we look in the general population, new HIV infections are generally higher among this 20 to 24 age group. There is need for higher and tertiary education institutions to generate more demand for HIV testing among their students through intensified HIV testing programs. Next slide, please. In terms of use of condoms, the baseline found that condom use is relatively higher amongst male students compared to female students, and this applied in both countries. So in Zambia, 62.8% of unmarried female students compared to 75.4% of unmarried male students, the first one was female, who had sexual intercourse in the past 12 months had used a condom during their last sexual encounter. So this data show that there's a sizable proportion of students that is not using condoms in risky sexual encounters with implications for their health outcomes. Next slide, please. In terms of sexual and gender-based violence, the baseline study established that both male and female students are susceptible to gender-based violence. However, female students are the most affected. The data shows that gender-based violence is occurring in higher and tertiary education institutions, and it needs to be systematically addressed for positive impact. So what was interesting is that despite respondents having experienced high numbers of gender-based violence, the baseline also showed that there's a lot of underreporting for sexual and gender-based violence, including sexual harassment. And the reasons given were because the burden of proof lies on the survivors rather than the perpetrators, and the requirement that one needs to prove beyond reasonable doubt that they did not give consent becomes a challenge. Fear of victimization for those who report, and limited confidence in the process followed in handling of sexual harassment cases. Next slide, please. In terms of the institutionalization of comprehensive sexuality education programs, the baseline sought to establish the extent to which comprehensive sexuality education, HIV, or life skills modules were institutionalized among the 24 institutions. What the study found is that few institutions are delivering a compulsory and examinable course. Most of the institutions are offering the course to students in particular faculties. So there are vast opportunities to advocate and work to influence the institutionalization of the modules within the teacher training, within the institutions. The next slide is on students reached with comprehensive sexuality education. So the institutions appear not to have deliberate mechanisms to track and record the number of students reached with sexuality education, whether through formal or informal means. What came out commonly was that the orientation week was the most common platform where students got some information. So I think the recommendation here is the institutionalization of a compulsory module, which will benefit all students across all faculties. In terms of tracking of project data, capacity to track project data will be critical to the ultimate measurement of impact or lack thereof of the project. What the baseline found is that on the ground, there are relatively weak record-keeping systems, particularly for health-related data on the campuses. So the responses obtained consistently described data tracking as either non-existent, poor, paper-based, overly manual, or hard to track. But all the institutions indicated lack of preparedness to manage the project, particularly collection of the required data. So this would be an area, an important area of focus. In terms of the institution's readiness to implement the project, the institutions have shown interest and enthusiasm. A quote from a respondent from one of the colleges was, they are qualified, competent, and interested staff members who can be trained to effectively implement the project. So what was clear is there is readiness from the institutions to get support to be able to implement the program. So when we move to the health facility assessment, on the management and ownership of health facilities on campus, the institutions have both physical infrastructure and human resources on which the program can build its support for the health facility component. So there are 11 campus-based clinics in Zimbabwe and 9 in Zambia, respectively. In cases where there are no campus-based facilities, students frequent nearby health centers, and this is often by agreement with the management of the institutions. In terms of provision of youth-friendly services, the baseline established that only 5 universities out of the 24 had healthcare providers that had been trained on the importance of respecting the rights of young people to information, privacy, and confidentiality. So the services that are currently mostly being offered, taken up by both sexes, were counseling and contraceptives. STI screening and treatment services were most common amongst male students, pregnancy testing, oral pills, and menstrual pain management more common amongst female students. So I'll quickly go to the recommendations in the interest of time. So one of the key recommendations is the importance of institutionalizing a course on comprehensive sexuality education that is accessed by all students across the campus, the development of codes of conduct and guidelines, paying particular attention to a holistic understanding of males as partners in addressing female sexual and reproductive health challenges and needs, and vice versa. Capacity building of lecturers and health staff, review and computerizing management information systems, promoting and supporting operations research and knowledge generation by the universities. In terms of, so I just selected a few of the key recommendations. You can see the rest there. In terms of the health facility assessment, the recommendations were around supporting the expansion, management, and equipping of health facilities so that students are able to access all the services that they need on campus without having to go outside. advocating and supporting the review of staff establishments to align with the increasing scope of the package of services, demand for after hours and weekend opening by students, because some of the students were complaining that the health facilities open during the time that we are in classes, so they were requesting more flexible opening hours for them to be able to access. Ensure consistent and efficient supply of medicines and commodities, including contraceptives and condoms, to meet the needs of young people. Ensure that health services are inclusive and meet the diversities of young people, especially those with disability and also young key populations. And then the need for higher and tertiary education institutions to explore and establish public-private sector partnerships for improving on-campus accommodation in the higher and tertiary education institutions. I thank you.
Thank you very much, Dr. Patricia Macharia. Tatenda. Tatenda a lot. I know a bit of Shona here and there because my first girlfriend was Shona. Her name was Rudo. And she taught me, the first thing she taught me is how to say, Andidi Zoktaura Taura. So you can tell that, it means I don't want to talk too much. It tells you that the relationship was not very healthy. It was, all right. Thank you so much for giving us that overview. And just to mention that the reports that Dr. Macharia spoke to have been put in the packages that you've received, so you will have access to them, and they'll also be available online. At this moment, I'd like to invite the students from Zambia and Zimbabwe to come and give us a student space tackling harmful masculinities. What can men and boys do to tackle sexual harassment, abuse, and exploitation at institutions of higher learning? University of Zimbabwe and University of Zambia, please. Zambia and Zimbabwe students, please.
Ladies and gentlemen, allow me at this moment to welcome the students from Zambia and Zimbabwe to come and give us an artistic play that we'll see when they portray about the 3O+. Enjoy and relax.
Nice seeing you, Mambwe. Are you aware that the CAs are out?
Yes, madam, I'm very much aware.
And did you make it?
I think so. I did not black out in the exam.
Mambwe, I'm sorry, but you're not going to write your exams.
What?
Yeah, you didn't make it. Look at your results.
Madam, I know.
Look at your results, ma'am. Look at your results.
Madam.
We were talking about this. Mambwe, look at your results. You are not going to write the exams, I assure you.
Madam.
Can you kneel down? Mambwe, kneel down. Mambwe, the third. You even call yourself the third as if it's a disease. You are not going to write the exams. I assure you that. We used to tell you.
But, madam, you can do a makeup test since we are remaining with the week.
I'm sorry, but we don't have time for makeup tests. You're not going to write your exams.
But why, madam?
You are not going to write your exams.
Madam,
You won't write the exams.
I'm the only son in the family who was made it to university, and this is total nonsense. My father will throw this.
And you were busy outside vibing a girl.
No, that one is a class rep. I was trying to find out about the class.
A class trip that you want to take to Zanzibar.
No, Madam Zanzibar, it's about history. We're learning about history.
I'm sure your father would love to see this history as well. You are not going to write the exams. Initially, Mambwe, I think there's something we can do for you to write the exams. There's something.
I can do anything.
You mean anything?
Yes, apart from killing a human being.
You mean anything, Mambwe?
Yes, madam.
This is what I wanted to hear. Anything. Do you know what the word anything means?
Anything, university.
I think that's the reason why you're failing. Have you ever checked your dictionary to see what the word anything means?
Yes, madam, very much aware.
Very much aware.
Anything, yes.
we can make plans, you know. As your lecturer, I think I can help you. We can make plans.
A makeup test?
No, ma'am, where you said anything. We can make plans, like anything. Just anything. Ma'am, where anything.
Madam.
Okay, ma'am, where you can go. Okay. You are not serious. It's like you don't. In fact, you can give your father this history. This is what is going to determine your future. You won't write the exams, I assure you that. You can leave my office.
Madam.
No, you can leave my office,
madam.
ma'am.
Okay.
Are you ready to do anything?
Yes, ma'am.
Okay, ma'am.
Hey!
Now I assure you, you're going to get a distinction in your exams. Good boy.
Ma'am. You look so sick. What's happening? I'm very okay, man. You're not okay, my friend. What are you trying to say?
You look so worried. What happened, my friend?
I'm very fine.
You're not fine. You're a man. Tell me.
Okay, what can you do when you are given an opportunity to be exploited against your wish?
Tell me what's that?
Okay, here comes. I have a friend
Yes.
who has been failing. Then he had an opportunity to meet with this lecturer. Very beautiful and everything nicely packaged. And they had something, like he enjoyed.
What's that? Tell me.
He enjoyed. Don't go to details, man.
You missed that opportunity, man.
Not me, my friend. Me, I'm okay.
Yeah, you tell me what's happened.
Okay,
Because you're worried.
the dude was raped.
The dude?
Yes.
You?
Not me, you. My friend.
You missed that opportunity, my friend. You're a man. That man cannot be
it
raped
seems
by a
like you don't know what you're talking about. Let me go and show you.
No. Tell me what happened.
The guy was raped
By who?
by the madam.
A guy has been raped by a woman. I'm not talking.
Okay, let's end this. The man enjoyed, and that's.
Okay, tell you.
I'm fine.
Wait. You can tell me this. Tell me.
I'm fine.
They don't understand what we share. They don't understand what we share.
This again.
What do you mean
This
this
again.
again?
I've warned you
Babe,
about
I was
this. I've
giving you
warned you
this
about
one.
this.
Look,
You don't want to give me what I want. You don't want to give me.
just
You
in the
don't want to
mood.
give me. Who is he?
Babe, what
Who
do you
is
mean?
he?
I only have you.
Who is he?
What do you mean?
Who is he?
Babe, what
If
do you
you're
mean?
not
I only
getting
have
it from me,
you.
you're probably getting
Babe,
it.
you're
Who
the only
is
person
he?
I have.
Shut up when I'm talking.
Babe.
Can you shut
What do you
up when
mean?
I'm
What do you
talking?
mean? What do you
Shut
mean I
up.
should shut up?
I said
No,
shut
no,
up.
no.
Shut up when I'm talking. I said shut up. I'm done with this.
He does this every time. Now it beats me. I can't report. I love my boyfriend. I love my boyfriend so much. I love my boyfriend. I can't report. Oh my God.
As we have seen from the drama presented to us, these are some of the challenges that we face as students. Pleasantries of the day to you all. Welcome to the O3+ talk show. Our topic for today is tackling harmful masculinity. What can men and boys do to tackle sexual harassment, to tackle abuse, to tackle exploitation?
Elderly men should be role models, daily demonstrating good behavior for a man.
Let us create a society where men are allowed to be vulnerable.
Let's not take excuses from abusers. A lecturer who abuses is an abuser. Let's stop protecting lecturers. Let us look at this issue with aggressiveness.
Let us shun stereotypes that say men are always strong and women are vulnerable and weak.
Let us change our attitude at all levels and know our rights.
As men, we need easily accessible financial support so as to reduce exploitation.
There is a need to strengthen our reporting system in our institutions.
We have come to the end of our talk show.
I am Al-Kebalan. I am Kush. I am the motherland, the birth of truth. I'm not Africa, and neither is my bush. I am that I am the tree of life that bears all fruit. Gender has become a felony. Freedom has become a felony. Courage is a felony. Masculinity has become a felony. Toxic masculinity has divided my mind and conquered my life. Took my brother's wife and made her his wife. Broke my sister's pride and left them to die. And yet you expect me to smile. Why praise discrimination, gender-based violence, power and greed when all we need is love and peace? So live on, kings and queens, for all we want is to be masters of our own destinies. Thank you. Born for the battles we never created. From conception to birth, we never experienced joy at birth. Our mothers cried with so much pain, and it was time for global crisis, and so they called us Mavuto. After all these sorrows, when our mothers cried, after giving birth to us, joy was filled everywhere. In our house, our mothers were happy. In our house, our fathers were happy. But questions, two questions. Are these questions making a reasonable question? UNESCO, Zambia, Zimbabwe, think, reason for a good reason. Do not reason just to reason. For reason cannot be reasoned without a reasonable reason unless there's a reason. O3+, our rights,
our lives,
our future. Thank you so much.
Another huge round of applause to the students. Fantastic. Reason for a reason. Don't just reason without a reason. Yeah. Yeah, fantastic. Reminding us of why we're doing this work, and that at this project are young people. At the center of this project are students and the issues that they highlight. Yesterday we had a chance to speak with the Minister of Education from Zambia, and he mentioned also seeing the students in the room that this is important, that students need to be on the table and that they've been part of the formulation of the O3+, because they are the reason we are here. At this moment in time, I would like to invite Professor Hubert Geisen, the Regional Director from UNESCO, to come and introduce the O3+. Prof.
Well, ladies and gentlemen, what a performance, and what a creative way of communicating by the young students. Let's give them another round of applause. I was really impressed by this, and Director of Ceremonies, I was also impressed by your introduction of everybody, so let me stand on your protocols. But I cannot avoid recognizing the presence of the Minister of Public Service, Labor and Social Welfare, the Honorable Professor Paul Mavima. Sir, thank you for joining us. And of course, also our guest from the neighboring country, Zambia, the Honorable Minister of Education, His Excellency, the Honorable Douglas Siakalima, Professor Mbowa, the host from UZ, thanks for hosting this event, and my good friend Manuel Turnhofer from the Swiss Development Corporation, Excellencies, Ambassadors, ladies and gentlemen. And while I said that our MC, no, it is a DC, Director of Ceremonies, did a very good job in eloquently introducing everyone, Remy, you forgot one group, and that's the people at the high table. The high table is usually here in front of us, and so COVID has changed the world, but it has also changed the way we organize events. And what you can see now, the high table, is our ICT support, and they have become the VIPs of today. So thank you guys, and bring some ladies next time. They're also good in ICT. You make it happen nowadays. We have live streaming. We have many connected via video conference. So while we are seated here with quite a few at a safe distance, we have many more connected at a very safe distance, and this is the new normal. We can join many events from far. So welcome to everyone. And let me start with the title, Our Rights, Our Lives, Our Future. This has really become a brand associated with comprehensive sexuality education and access to youth-friendly services for young people across the Sub-Saharan Africa region. And it is a collaboration between UNESCO, member states, and young people in formal and non-formal education settings. Now, the O3 Plus, it almost sounds, I'm giving here a lecture in chemistry, O3 Plus. So the O3 Plus seeks to extend the partnership to include young adults in post-secondary education settings, including colleges, polytechnics, and universities. And therefore, the title O3 Plus. It underscores the principle of leaving no one behind and tapping into human resource capital to accelerate the attainment of the 2030 Agenda for Sustainable Development. Ladies and gentlemen, what are we actually launching today? We are not just launching another program, another project. We are launching innovation. And we are launching a new partnership. We are also launching a story of positive change for young people. We are launching a unique contribution to the Africa we want. So the O3 Plus program seeks to get us to Agenda 2063, which in my view is not an agenda, it's a very strong vision of the African Union. To an Africa where HIV is no longer a public health threat, the O3 Plus has an ambitious vision of a young African who is empowered, educated, healthy, resilient, and socially responsible. A decision maker, a young person growing up to become a decision maker with the capacity to continue to the development of her or his community or country, and of course the region. Now, how will this happen? The O3 Plus program will target young people in institutions of higher learning in East and Southern Africa to start with, and equip them with skills necessary for, first, realizing positive health, education, and gender equality outcomes. 2, protecting themselves from HIV. 3, preventing unintended pregnancy. 4, protecting themselves from gender-based violence. And last but not least, ensuring good physical and mental health condition. It all began with the O3 program, which Patricia explained, and which has spread across 33 countries at the moment where this program is being implemented in its current phase. And this was done in partnership with all the 33 member states, ministries of education, other government entities and institutions, and a wide range of development partners. Now, the O3 program advocates for consolidation of country efforts towards the attainment of impact level results for, first, the reduction in the number of new HIV infections, reduced rates of early and unintended pregnancy, reduced rates of gender-based violence, and also reduced child marriage. Now, the O3 Plus program has generated a lot of interest from partners. It now extends to 8 countries across Eastern and Southern Africa with the support from SDC Switzerland, Sweden, Norway, Ireland, and France. And today, we are so happy to launch the O3 Plus for Zambia and Zimbabwe, and I'm so pleased to see the 2 ministers from the 2 countries here together. This is an important opportunity, I believe. We see so many projects and programs being contained within a country, within a certain institution, and this is a project that is cross-boundary because there is so much to be learned between institutions, between partners, and between countries. So thank you very much, honorable ministers, for underlining that via your presence here today. So just how ambitious is the O3 Plus program? Across the 8 countries, the project will reach numerous institutions. You have heard already how many institutions are here just today for the launch of the 2-country program. And this includes universities, polytechnics, and technical and vocational colleges. 253,000 students will receive accurate, right-based CSE. Over 152,000 students will be tested for HIV. 168,000 students will be linked with SRHR services. 2,130 healthcare providers will be reached with training to provide quality and tailored SRHR information services. Now, phase 1, which targets Zambia and Zimbabwe, will partner with 24 institutions, reaching a total of 135,000 students. And we know that tertiary enrollment rates are going up fast, and that there's more and more demand for these services, by the student population. Now, drawing on UNESCO's unique mandate in higher education, the O3 Plus will transform negative stories about college life into positive stories of change for the students. The logic is that young people who are equipped with the right knowledge and skills are able to make better decisions regarding their health and education outcomes, to question unequal and harmful gender norms, underlying gender-based violence, and to reduce their risk of abuse, exploitation, coercion, unintended pregnancy, and HIV and other STI infections. Now, to realize this, the O3 Plus considers 4 pillars. And in closing, let me just share these 4 pillars with you. The first, to support the institutionalization of CSE, SRHR services and prevention of, but also response to, sexual and gender-based violence across the higher and tertiary education sectors. The second, to strengthen the capacity of campus health facilities to offer a trusted standard package of youth-friendly and accessible health services for students. The third, to support the development, implementation, and effective enforcement of laws and policies to protect students from sexual and gender-based violence. And last, fourth, to commission epidemiologic and operations research studies to generate a body of knowledge for a deeper understanding of SRHR in tertiary institutions. So, with that, what does the next slide say? Join us to make this happen. Thank you very much.
Thank you so much, Prof, for the introduction to the O3 Plus. Really amazing to see the numbers that the program is attempting to reach. Nearly 60,500 students in Zambia, nearly 75,000 students in Zimbabwe. If we do get it right, this is a huge, huge investment for the future. And as you were talking, Prof, I was just reflecting on my own journey, you know, as a young person and then transitioning into adulthood. And at what point, you know, did I get this information? I think I was one of the few lucky ones to have the information before getting into a sexual relationship. But if you ask that question to a lot of young people, the story is different. It shouldn't be luck, it should be deliberate, that we give the right information and the tools necessary for young people to make informed decisions. So you're really excited, you know, over this program. At this moment in time, I'd like to invite the Permanent Secretary from the Ministry of Education in Zambia, the PS for Technical Services, Dr. Jacobix Kalumba, to come and introduce and invite the Honorable Minister. Doc.
Director of Ceremonies, my name is Jobix. Yes. J-O-B-B-I-C-K-S. One word. If you break it into two, there is Job and Bix. Bix comes from complaining. So my elder brother nicknamed me Job Complainant. but now when I grew up, I realized that I don't complain about Job. I like it so much. Anyway, it has come. Riding on the protocols already given, I've checked here. My role is to introduce the Minister of Education. But it's from 10 what? It's about 5 what? 5 minutes. I don't know that introduction. So I'll go a bit deeper in introducing the Minister. ladies and gentlemen, before us is the Honorable Minister of Education in the Republic of Zambia. His name is Douglas Siakalima, the Member of Parliament for just a nearby constituency, which is Chirundu in Zambia. It shares the boundary with the Republic of Zimbabwe. Honorable Douglas Siakalima is an educationist. He is a teacher by profession. He has done a lot of work in the Ministry of Education, in particular, university education. He has been a lecturer in the school, I don't know if it's the Department of Psychology, for so many years. Honorable, it's about 23 years, isn't it? Over 23 years. So for us in Zambia, we are delighted in the sense that we now have an educationist in the Ministry of Education. And I'm very confident with him and the team at headquarters, we will transform the landscape of education in Zambia so that the rights of our students are observed. And when that is done, the lives of the students in institutions of learning will be transformed, which will lead to creating a future in the lives of the students. So, ladies and gentlemen, join me in welcoming the Honorable Minister of Education to come and give a speech. Honorable Minister, I welcome you. I welcome you and invite you. Thank you.
Vice Chancellor, it is an auspicious time to be at the University of Zimbabwe. After over 25 years when I was here, I came to check what they were doing in the Department of Psychology, the unity under forensic education. I hope they still call it that way. Thank you. So nice to be here. The Honorable Acting Minister of Education, who is also a Minister of Public Service, Labor and Social Welfare, Your Excellencies, Ambassador of Sweden, Ambassador of Zambia, Swiss Agency for Development and Cooperation, Regional Director of Cooperation, the United Nations Resident Coordinator, UNESCO Regional Director and Representative, UNAIDS Country Director, the UN Family in Zimbabwe, Permanent Secretary, Ministry of Higher and Tertiary Education, Innovation, Science, and Technology Development. It's quite lengthy, huh? The Permanent Secretary, Technical Services, Ministry of Education, Zambia, Vice Chancellor of the institution, University of Zimbabwe, Vice Chancellors from institutions in Zambia and Zimbabwe here present, college principals from project institutions in Zambia and Zimbabwe present, CEO, Zimbabwe Council of Higher Education, CEO, National AIDS Council, Dean of Students, senior government officials, representatives of civil society organizations, and more importantly, students from Zambia and Zimbabwe here present. Ladies and gentlemen, good morning. Good morning. I wish to begin by thanking my colleague, the Minister of Higher and Tertiary Education, Innovation, Science and Technology in Zimbabwe, and through him, the wonderful people of Zimbabwe, for the warm hospitality rendered to me and my delegation since we arrived here. I'm greatly honored to lead the delegation from Zambia to the launch and signing ceremony of our rights, our lives, our future, the O3+ project here at the University of Zimbabwe. Allow me at the outset to sincerely thank our partners, the people and government of Switzerland, for providing financial resources for this extremely important project, and the United Nations Educational, Scientific, and Cultural Organization, UNESCO, for providing a platform on which this project will be rolled out in the targeted higher learning institutions, both in Zambia and here in Zimbabwe. Your support cannot be appreciated enough. Ladies and gentlemen, allow me to further recognize the active engagement that has been exhibited by the leaderships of the selected universities and colleges in ensuring that the required information when conducting the baseline surveys was easily provided to the consultants. Without that information, it would be extremely difficult to adequately put in place a result-oriented executable plan. I further thank UNESCO teams from both Harare and Lusaka that worked with government officials in our ministries and all key stakeholders to ensure that today we can sign and launch this project. To the students in the targeted universities and colleges, I am inspired by your commitment to this cause and for recognizing that it is all about you and your sustainably successful futures. Ladies and gentlemen, in Zambia, we have so far done significant work in the implementation of comprehensive sexuality education programs in primary and secondary schools since the Eastern and Southern Africa commitment was signed in 2014. As a result, we have seen a significant reduction in early dropout from school, especially for girl children. We have also seen a significant improvement in the awareness levels of the rights of our pupils in schools. We have, however, realized that even with the gains and progress achieved in the lower levels of education, young people become even more vulnerable as they leave secondary school and enter university or college education. When young people enter university or college, they gain a great level of freedom from their homes where there are restrictions on movements. This newly found freedom can be a source of various forms of unwanted behaviors, such as illicit sex, which exposes them to sexually transmitted diseases, including HIV, alcohol and drug abuse, unwanted pregnancies, psychosocial challenges, and other peer pressure-based problems that can affect the students' ability to concentrate and finish their studies. Ladies and gentlemen, in our universities and colleges, we are faced with some challenges as we strive to deal with these problems. Some of the challenges relate to our ability to develop and roll out information programs that inform students on the best behavioral options as they navigate their higher education journey. Other challenges relate to infrastructure, such as adequately equipped and staffed health facilities where students can go in an event of an unfortunate situation. Therefore, we are very happy that today we launch the project that will help us deal with some of these challenges and create the right environments in our institutions of higher learning. Ladies and gentlemen, it is also important to recognize that some of these challenges are not just caused by the students themselves. We have seen cases where members of staff, including lecturers, take advantage of female students by demanding sexual favors for better grades. We have also, conversely, seen cases where female students entice lecturers with sexual offers in exchange for good grades. I therefore urge implementers of this project to ensure that programs encompass the entire spectrum of these challenges so that adequate and transformational information is provided to both students and members of staff. I am aware that this project will be implemented over a period of 4 years with the possibility of extension. I have no doubt in my mind that we will make great strides over the initial 4 years. But my hope is that we should do so well, that the next phase should include even more universities and colleges beyond these participating now. I also hope that as we plan, we will focus on sustainability. We should ensure that what this project will begin should be sustainable beyond the life of the project, so that even those children who will go to university in the next 12 years should benefit. With this, I wish to encourage our partners to consider mobilizing even more resources so that we can expand coverage and do more to create conducive environments in our higher learning institutions based on the rights, lives, and futures of our learners. Ladies and gentlemen, I wish to end by encouraging the students in both Zambia and Zimbabwe who will be part of this project to take it as their own, to achieve the impact we seek through this project. Students should take center stage by suggesting innovating ideas of how to package the information so that their fellow students get it right. Students should be the change makers beyond university campuses. During holidays, students should be ambassadors of these programs when they get back home. Our role as governments, on the other hand, is facilitatory by providing the policy environment and platform for such wonderful programs, to be implemented. The bulk of the work lies with the students themselves to be able to embrace what is given to them and realize that it is only through behavioral change and information sharing that we can achieve the objectives of this project. As we launch this important project, I wish you all fruitful engagements and hope that the networks that will be created today will be lifelong. This launch can be referred to as the strength for today and a great hope for tomorrow. The strength for today and a great hope for tomorrow. I thank you all of you again, and may God bless you.
Thank you very much, Honorable Minister, for those remarks, and really a great call to all the stakeholders, on this project. And strength for today, a great hope for tomorrow. Strength for today, great hope for tomorrow. Thank you for those words. I'm hearing Prof saying it's a good slogan, right? New slogan. Yes, let's hashtag that. Let's hashtag that. And make it viral. Honorable Siakalima was my lecturer back at the University of Zambia, at the best university in the world. So, if you've spoken to him, he's very soft-spoken, he's gentle. So he would come in class and it would be this kind of setup, and we didn't have it's a long time ago, I'm very old. And he would be speaking in a very calm voice. If you try to shout and say, "Sir, we can't hear you, we can't hear you." Then he would speak very fast and very calmly. And the things he would say in that very moment are what will come in the exam. So I was telling this to my wife, and then she said, "Oh, but Wena, why wouldn't you sit in front?" I said, "I'm not that kind of a person. I was a backbencher at the back there." It's really nice to see you again, Honorable, and congratulations on your appointment as Minister of Education. We're really excited, and as somebody that is passionate about mental health, I'm really excited to see you in that office, and I know that the ministry will invest a lot even in that area as well. All right, at this moment, I'd like to, and apologies for getting, I don't know where I got that name from, because it's here, Jobbix. And in fact, at UNZA, it means something different, you know, like a jobbist. It's a jobby, yeah, a person who studies a lot, reads a lot of books. So, sorry, Doc, for that, and I'll get it right. Let me invite then Mr. Manuel Thanofer, the Regional Director of Cooperation from SDC, to also come and give us some solidarity remarks.
Thank you. Thank you very much. Honorable Minister of Public Service, Labor and Social Welfare of Zimbabwe, Honorable Minister of Education of Zambia, Your Excellencies, Ambassadors of Zambia and Sweden, United Nations Resident Coordinator, UNESCO Regional Director, agencies, UN agencies, permanent secretaries of Zimbabwe and Zambia, vice chancellors, college principals, dean of students, senior government officials, representatives of civil society, students, ladies and gentlemen. It's a pleasure for Switzerland to participate in this event. The Swiss Agency for Development and Cooperation has been engaged for more than 20 years by now in HIV prevention and sexual and reproductive health and rights for young people in this region. Young people are the key to development in Southern Africa and to sexual and reproductive health and rights. And there is still so much work to be done. We live in a context where access to sexual reproductive health and rights for young people is still a challenge. There is incorrect and insufficient knowledge of the issues, inconsistent use of contraceptives, lack of access to education, employment, and health care, as well as legal, structural, and resources barriers. At SDC, we seek to tackle these issues and finance programs that help boost HIV prevention and access to sexual reproductive health and rights, as well as develop new health policies that addresses the needs of adolescents and young people and improve sexual and reproductive knowledge. Our various programs have linked school to services, helped make services more youth-friendly, invested in social norms change, and championed psychosocial support. However, we noticed a gap in our programming. So much of our efforts have disproportionately focused on the adolescents. Young men and women aged 18 to 24 have become an often neglected cohort with very few programs tailored to their specific needs and context. This trend is exacerbated by the incorrect assumptions that students in this age group already know it all. On the contrary, due to patchy implementation of comprehensive sexuality education, many young people still enter their 20s without adequate knowledge, placing them at an even more elevated risk for unintended pregnancies, sexual abuse, and other negative outcomes. The evidence bears this out. So in fact, young people in this age group are navigating new responsibilities, relationships and experiences on their own and in unfamiliar settings for the first time, often with detrimental consequences that cut deeply across gender lines. With this project, we are eager to make a first step in meeting the health and sexual reproductive health and rights needs of almost 600,000 young adults who attend tertiary institutions across Zambia and Zimbabwe. Many, if not most of them, from the lower middle class of society. These institutions are where groups of 18 to 24 years olds are most highly concentrated and where negative sexual health outcomes and gender-based violence are most at risk of spiraling out of control. While some tertiary institutions offer sexual reproductive health and rights services, they struggle with dilapidated and inadequate infrastructure, commodity shortages, confidentiality concerns, unclear protocols for addressing sexual and gender-based violence, and many other challenges. The situation has only been exacerbated by the emergence of COVID-19 and its many ripple effects. The O3 project will provide platforms for addressing some of these main challenges. We view this as important given that effective sexual reproductive health and rights requires us to use a life cycle approach. One that recognizes the age appropriateness of interventions and that the needs and challenges of a tertiary student living independently, often for the first time, and dealing with new responsibilities differ from those of primary and secondary pupils living at home. Ladies and gentlemen, this project envisions safer, more inclusive and more supportive campuses in which students not only use and have access to improved sexual reproductive health and rights services, but also benefit from robust and institutionalized policies and curricula that have been established nationally and regionally. Through empowering these young people and bringing them on board as advocates for equal access to health, good practices will spill over into other sectors as graduates enter the job market and become leaders within their households, communities, societies, private sector, and governments. We as SDC are very keen to work closely with the participating institutions in both countries, as well as with our government counterparts in making this project a success. Switzerland is seeking to considerably deepen its relationship with Zambia and Zimbabwe as our international cooperation begins to shift from a regional approach to a stronger focus on those two countries with an emphasis on basic social system strengthening, among other, in the years ahead. So we look forward to taking this journey with you. I would like to thank the University of Zimbabwe, the governments of Zambia and Zimbabwe, and of course UNESCO for partnering with us and sharing in this important event. I thank you very much.
Thank you very much for those words, Mr. Manuel Tanofa from Switzerland. It was the first country I visited right after university, Switzerland. In fact, I didn't attend my graduation ceremony because I had been accepted at UNAIDS to do a fellowship right after my exams. And, you know, coming from Zambia, it was an interesting space. First time being out of Africa. But what I liked is the timekeeping of the Swiss people. That was really good. I mean, if the bus is going to leave at 8:03, it will leave at 8:03. If you come there at 8:04, you will miss the bus. If you see the bus leaving and then you wave and run for it, the driver will not stop. It's more like Zambia. Yeah. So Prof is saying, no, it just means you're too early for the next one. Exactly. So we have a lot in common, the Zambia and Switzerland. At this point in time, I'd like to invite the Permanent Secretary of Higher and Tertiary Education, Innovation, Science and Technology Development from Zimbabwe, Professor Tagwira, to come and introduce as well as welcome the Honorable Speaker, Minister. Professor. Just a second. Sorry. Hey, it's tough.
Well, allow me to start by acknowledging our program director. I think he needs to be ISO certified. You are the best program director I have ever come across. Thank you very much. The Honorable Minister of Public Service, Labor and Social Welfare for the Republic of Zimbabwe, Professor Dr. Paul Mavima, the Honorable Minister of Education for the Republic of Zambia, Honorable Douglas Siyakalima, Excellencies from the Embassy of Sweden and the Embassy of Zambia, distinguished colleagues, allow me to ride on all the other protocols and say all protocols observed. It is an honor and a privilege for me this morning to introduce my minister in the government of Zimbabwe, Professor Dr. Paul Mavima, a Zimbabwean national. I won't tell you the date when he was born, except to say he was born in Kwekwe, here in Zimbabwe. A holder of a Bachelor of Science in Political and Administration at the University of Zimbabwe, and a Master's in Public Administration from the same university. So you can see he has come out of the mold of this institution. He holds a PhD in Public Administration and Policy from Florida State University in the United States. 1987 to 88, he was an administration officer with the Ministry of Public Construction and National Housing. Then he came back to the University of Zimbabwe, where he worked from 1988 to 1990 and 90 to 94 as a lecturer in the Department of Political and Administrative Studies. In 1994, he became a Fulbright Fellowship. He got a Fulbright Fellowship to go and study for his PhD in the United States at Florida State University. After his studies, he became a teaching and research associate at Florida State University, and then became a policy analyst in 2000 for the Parliament of the State of Florida in the United States. In 2000 to 2007, he was an assistant professor at Grand Valley State University in Michigan, in the USA. And then he was then promoted to associate professor of public administration and policy at the Grand Valley State University. March 2009 to July 2013, he came back home and he was made a principal director in the office of the Deputy Prime Minister, Professor Arthur Mtambara. I'm sure those from Zimbabwe, you know that's the time of the GNU. Professor Mavhima was elected as a National Assembly member for Gokwe Sengwa constituency on July 31, 2013. On 13 September 2013, he was appointed Deputy Minister of Primary and Secondary Education. And then on 2nd December 2017, he was appointed the Minister of Primary and Secondary Education for the Republic of Zimbabwe. Currently, Professor Mavhima is the Minister of Public Service, Labor and Social Welfare in the Republic of Zimbabwe, having been appointed to that position on the 8th of November 2019. Ladies and gentlemen, we have a man who is very familiar with higher education, a man who has been a higher education administrator, an academic who has taught in the universities. He understands the challenges that our students are going through in the various campuses across the country. Even in his capacity as Minister of Public Service, Labor and Social Welfare, Professor Mavhima is very well versed with issues of gender, equality, and sexual and reproductive health. And so therefore, he is an appropriate man to give the guest of honor speech on behalf of the Minister of Higher and Tertiary Education, Innovation, Science and Technology Development, Professor Dr. Amon Mugwira. It is my honor, therefore, and privilege at this stage to call upon our minister to come forward and deliver his address. Thank you.
Let me start by acknowledging the youthful and very exuberant Director of Ceremony. Reminds me of a time when we were running the Southern and East African winter school here at the University of Zimbabwe, and we would bring students from UNZA as well as other universities in the region, and the same vibrance still exists, and I could also see it in the students who are representing Zambia here today. It's a beautiful memory that is being rekindled, and we thank all those who have made it possible. Let me acknowledge the presence of the Zambian Minister of Education, Honorable Douglas Siakalima, ndapotsa ndati Siakurima. We have Siakurimas here, and the name sounds very much similar. And I want to congratulate you for the recent appointment into this very important portfolio. It is a portfolio that shapes the future of a nation if handled very well. And we wish you success in that portfolio. Let me recognize Excellencies, the ambassadors of Sweden, Switzerland, and Zambia, representatives of the UN family. I understand there is UNESCO is here, well represented, but there is also UNITES and UNICEF. We thank you for coming. The Permanent Secretary for the Ministry of Higher and Tertiary Education, Innovation, Science and Technology Development, Professor Fanuel Tagwira. And I want to say just a small explanation of this, ministry name. It resonates with the Education 5.0 that we have seen being implemented. And the name reflects what is happening as far as innovation and technology development in Zimbabwe. And we have really seen a big difference, especially with the coming in of a new cadre at the policy level with Professor Dr. Amon Murwira, and at the permanent secretary level with Professor Tagwira. We are making very big strides in innovation and technology development. The permanent secretary for the Ministry of Education in Zambia, Dr. I don't want to, is it Jobkin? Jobix. Jobix. Yeah. Mulwanda. Kalumba. These people making me look ridiculous here. But anyway, Kalumba is much easier than Mulandwa. The director and representative of UNESCO Regional Office for Southern Africa, Professor Hubert Huizen, who is here and who has been in this country and representing this region for a considerable number of years. He has become one of us, a colleague, in the various programs that we have been implementing together, specifically also in the education sector. The Vice Chancellor of the University of Zimbabwe, here represented by the Pro-Vice Chancellor, Professor Mbowa. Vice Chancellors and principals from institutions in Zambia and Zimbabwe, we have seen quite a number, and I understand 24 institutions are represented here, and we could see the representation as you were introduced. UNESCO Regional Advisor on Education for Health and Well-Being, Dr. Patricia Machawira, who gave us that good presentation. Senior government officials here present, civic societal organizations here present, student representatives, we thank you for bringing your voice to some of these issues that we're dealing with today. And we would like you to continue to be ambassadors. Professor Mbowa talks about Ubuntu. it's the heritage aspect of this entire thing. We want you to carry that on and really be ambassadors who will spread the word about O3+, to the rest of other students in the institutions where you come from. And you are winners by just being here today. Distinguished guests, ladies and gentlemen, it is an honor and privilege for me to stand here to address you representing my colleague Minister of Higher and Tertiary Education, Innovation, Science and Technology Development, Professor Dr. Amoni Murwira, who could not be here today because of other commitments. We are gathered here for the launch of the O3+, running under the theme, Our Rights, Our Lives, Our Future, which seeks to ensure that young people in higher and tertiary education institutions in the East and Southern African region realize positive health, education, and gender equality outcomes through sustained reduction in new HIV infections, unintended pregnancy, and gender-based violence. The O3+ project will support institutionalization of comprehensive sexual education module across 31 higher and tertiary education institutions within Southern and East Africa. Reach over 228,000 students with accurate, rights-based, comprehensive sexual education. Support strengthening of referral mechanisms to specialist care and support services for students. Link over 156,000 students to appropriate sexual and reproductive health and rights services, and support mobile health services and enrich programs to advance sexual and reproductive health and rights service uptake, where over 147,000 students will be tested for HIV. So this is indeed a considerable program that is going to impact the lives of many of our young students in our institutions of higher learning. I don't want to sound cliched, but the reality of the matter is when someone gets to this level of education, a lot has been invested, and that investment is priceless for the development of any nation. It is in education, as in health, that if a nation misses, then the whole development agenda collapses. The whole idea of the demographic dividend derives from adequate and optimal investment in health and in education. Once you have that, you can almost be assured of a bright future. And the focus should be at an early enough stage for the young population that constitutes the majority of African countries, including our two countries, Zimbabwe and Zambia. The project is also expected to promote inclusiveness for vulnerable and marginalized young people, such as persons with disabilities, those living with HIV, and other populations through supporting the 31 higher and tertiary education institutions to develop and/or revise relevant policies to guarantee tailored access to comprehensive sexual education and sexual and reproductive health information and services. Additionally, 2,130 healthcare providers and 5,300 peer counselors will be capacitated to provide quality and tailored sexual and reproductive health and rights information and services. Zimbabwe launched the National Development Strategy, which will contribute to the attainment of an upper middle income economy by 2030. To achieve this vision, Zimbabwe needs to build an innovation-led and knowledge-driven economy. This requires the country to have a healthy and vibrant human capital. Zimbabwe has adopted heritage-based education 5.0 in an attempt to build skilled human capital that can contribute to national development. An aspect of this trajectory in education also speaks to Zimbabwe exploiting the value chains of its heritage resources, like minerals, natural resources, and flora and fauna. We want to extend the same heritage approach to this project. The values that kept our communities, our families together, should be infused into this program that is called All 3+. The Ubuntu, UNU, that Professor Mbowa referred to should also be part and parcel of that approach. Zimbabwe's most important resource are its people, and that is a palpable reality. You go anywhere in the world, you will see a Zimbabwean in important roles in all sectors that you can think of. And that's because we have had a heritage of developing our human capital. The changes that are taking place now will only strengthen that. And so not only has Zimbabwe achieved literacy rates that are far higher than those of its African counterparts, but it is known for its high-quality human capital working all over the world. However, going into the future, these gains stand threatened with drug abuse and deteriorating sexual reproductive health. It is heartbreaking to see a young person who has just graduated, sometimes with degree classes of even first class or upper second class, really completely destroyed because of drug and alcohol abuse and other vices. That's again a loss on that priceless investment that the nation will have made. So we need to stem this, and we need programs like this one in order for us to be able to deal with these issues, these vices. The nation must guard against these vices through projects like this one. Our students should be supported to shun these deleterious behaviors and be able to reach their full educational potential and contribute more effectively to the development of their country in their various professional fields. That's the essence of the demographic dividend we are seeking. Vakawanda vari vadiki vakadzidza vochisapota vakura, the elderly, nevasati vakukwanisa kuzvisapota. We need to reap real benefits out of that, but we don't want to lose that potential through the vices that we have referred to. It is important that we remain vigilant. The Ministry of Higher and Tertiary Education, Innovation, Science and Technology Development, and our key partners, UNESCO, will support innovation in access to life skills-based sexuality education and sexual and reproductive health services for higher and tertiary education students, while advocating for policy and practice changes to make campuses safe and inclusive learning environments for students and staff. We, as government, have now put together a task force which includes my ministry, the Ministry of Higher and Tertiary Education, and a few other ministries to deal with issues related to this program. And at the moment, when we are going through our budgetary process, we are giving the various sector leaders in this fight the resources that they need so that we can roll out this program in 2022. The reality of the region is that too many young people are still growing into adolescence and adulthood with very little knowledge about the reproductive health and sexuality, having missed it at lower school or emerging life cycle needs, and in the context of poor access to sexual and reproductive health services. Higher and tertiary education institutions cater for sexually active young people, mostly in the age group of 18 to 30. This age group is vulnerable to sexual and reproductive health and rights-related concerns and risks as they navigate new responsibilities, relationships, and experiences on their own and in unfamiliar settings. Students are at risk of negative sexual and reproductive health outcomes, such as unintended pregnancies, sexually transmitted diseases, mental health-related issues, and all these can cause disruptions in educational attainment, career progression, and life goals, ultimately limiting the potential of critical human capital to contribute towards national development and leadership. It is frequently assumed that because students have reached the tertiary education level, they have already received the education that equips them to avoid negative health outcomes. There has been a significant focus and investment in the region in recent years on increasing the provision of comprehensive sexuality education in primary and secondary schools, giving much less attention to higher and tertiary education institutions, students. As a nation, let me join my colleague, the Minister of Education from Zambia, in expressing gratitude to the generous support by the governments of Switzerland, Sweden, France, Norway, and Ireland. I am reliably informed that the O3+ edition will focus on the higher and tertiary education cohort in 8 countries, namely Zambia, Zimbabwe, Kenya, Tanzania, Namibia, Rwanda, South Africa, and Uganda. In Zimbabwe, the project will go a long way in the support of developing a healthy human capital towards the national vision of an upper middle income economy by 2030. Ladies and gentlemen, it is now my singular honor and privilege to declare the O3+ project officially launched. I thank you, and may God bless you, and may God bless our 2 beautiful countries, Zambia and Zimbabwe, and indeed, may God bless Africa. I thank you.
Thank you very much, Honorable Minister, for gracing this occasion and for taking some time out of a busy schedule to come and be with us. You said a lot of beautiful things, but the most beautiful thing you said was to call me a youthful and exuberant. And I'd just like to say, Honorable Minister, that when the PS was coming here to welcome you, he whispered in my ear and said, "We need to keep you here." So I will start my immigration processes. And I'm not even very difficult to maintain. I don't need a lot at all. At this time, we're going to have a musical interlude, musical piece, as we set up the table for the signing ceremony. Please. And I forgot to introduce the sign language speaker I had introduced earlier, Priska. This is Susan Masona. Thank you so much.
Mapweni kwejibo kamwe bango. Enandola baleni katika yese. Urusaka bali fembondo katika yese. Mena kite baleni katika yese. Masabongwe baleni katika yese. Na yese nishia na ebe mweke mayanu.
Jerusalema ikayalami ilondoloze uhambe nami zungangishilana Jerusalema ikayalami ilondoloze uhambe nami zungangishilana dawo yami ayikholana buso wami awukholana ilondoloze zuhambe nami dawo yami ayikholana buso wami awukholana ilondoloze dawo yami ayikholana buso wami awukholana ilondoloze zuhambe nami dawo yami ayikholana buso wami awukholana ilondoloze
Abamadega no tsembe. Selako. Wapia chandana ke. Chanalilo wet kongo mukate. Kanshkulo ni fotate mukate. Vini vimite vya wami pelete. Ako iye kawanyori aka. Kolombo mwane tira sikaniri no. Kuku nawe maula mpesha limo. Kura kadui mwe ibenge milimo. Ako iye kawanyori aka. Dance kawanyori keshile koso. Kakushana na matakolu koso. Kale tena lero te budimi bwakale kisa shinana nikane opambale ako iye kabanyori aka chapu wonze de mimono kufina chandana kende mimono kufina shitobelo mbu basala fina ako iye kabanyori aka pole pole nya potete ngako seko siyateka iteke mushambonyanga na pena mundeke ako iye kabanyori aka no konko wapya baisa Balila badila bana badila titichalila chalila afunyapo kanshina bamulwadila ako iye kabanyori aka afurwa papa apura katani fra papa pela dobo tekina fura papa ako iye kabanyori aka ufusha chilo we bapangire seko baifine bavina pa musebo era kubepa fwe banyori ni fwebo ako iye kabanyori aka 20 years boy so mina push can stage what so mina if you do recover bomb to mina ako iye kabanyori chanda na keto papa mote umo palo mbele chimoto papela mona chibwabwa mukansebanya chabashani pasopo atima twins mofara na kompo idesha face mask oro ya sopo bam bam penny kulu bam ngeje da konga bubble gum toka gam buga as bam mumujis pobizo kadenene chumwana paka nyawi para kanene kalud ni amene
Wonderful, wonderful, wonderful. Fantastic display of talent there. Colleagues, could you just help? Yes. I was asking Prof if he wants to join, and then he said, Remy, it's too early, Maybe later. But fantastic, fantastic. Sorry. And thanks, Alice, for representing UNESCO very well. Very, very well. We didn't know we have that talent in the house. Not only do we have handsome men, we also have dancers in the house. Wonderful. In the next agenda item, we're going to go into the signing of the agreements. And for this one, I will invite the two permanent secretaries, Professor Tagwira and Dr. Jobix Kalumba, to come forward, please, as well as Professor Geisen and Mr. Manuel Tanofa, to please come to the front and take their seats. So UNESCO at the to the far left. Is it? Okay. Thanks, Patricia.
Let the whole
now I would like to invite the rest of the VIPs, if you could join for official popping of something to just make a celebration of the launch. So honorable ministers and delegates, if you could just join at the front, and maybe if we could stand in front of the table and we'll move the chairs out for the popping.
kupembedza dzinza rese rotutuka budiriro yako ndedo iwe musunguru kanondo onasa wira wotambeko wazvinzvaka wandinzvaka
Nasinde zvedu itama gorokoto kwati wenu wanadisa wazvinzvaka mazvinzvaka nasinde zvedu itama gorokoto kwati wenu wanadisa wazvinzvaka
wazvinzvaka iwe
mazvinzvaka
wazvinzvaka iwe
All right, so I hope we all have poppers. So these are poppers. They pop. And when they pop, they make a popping sound. So I hope we are ready for the popping sound. So to operate this, so you just have to hold it with both hands, one holding the top part, and then the other hand, the bottom part. And then you will twist clockwise. So clockwise, yeah, you twist using the right hand, the bottom hand, clockwise. And then, whoa! Yeah, so if you could do it together, that would be nice. So I'll count and then we do it together. I'll count and then we do it together. Prof, I can give you another one. Okay, so did we get the instructions? No? Okay, so you hold it like that. Let me see, Piers. Yeah, so you would twist the bottom part clockwise. Yeah? Okay. Clockwise. Oh, okay. 1, 2, 3, go! Music, music. Young people and students, please come and take some photos as well before the delegates sit down. Before they sit down, please come and take some photos. Yes, please. Thank you so much. You can take our seats, honorable ministers and esteemed guests. I hope we got enough photos. I hope we got enough photos. That's where no one will say they were not here. we have the photos. Yeah. Looks beautiful. Thank you so much. You might sit down, please. I'd like to then invite Ms. Chirapa and Dr. Ndakala to come and present gifts to dignitaries. These are the NATCOM Secretary Generals from Zambia, Zimbabwe and Zambia respectively. Let's encourage them. Yeah, maybe there's a brush in there. Thank you very much, Ms. Chirapa and Dr. Ndakala. I will now invite the two students from Zimbabwe and Zambia to come and give some vote of thanks. One, two.
So it was yesterday night when my fellow students asked me to do the vote of thanks. So I asked them, why me? And then they said they encouraged me. So here I am doing the vote of thanks. A good day to you all. Allow me to express my pleasure to deliver the vote of thanks for this event. A tree with disordered roots, we will have disordered branches. A child who is never allowed to speak will never develop into an adult who can lead a nation. With this in mind, we would like to express deep gratitude to our elders, ambassadors, UNESCO, and respective countries, Zimbabwe and Zambia. Thank you for setting up a platform where our voices can be heard. Beyond hearing our voice, you are taking away the thorn in our flesh through this project that you have launched today. As students in tertiary education, we face a lot of challenges from lack of accurate information of CSE and SRHR, insufficient devices, exploitation by lecturers, and gender discrimination and limited healthcare. Our greatest hope is for the project O3+ to have positive impact and empower the youth as it aims to create awareness and realization of positive health, education, and gender equality through sustained reduction in new HIV infections, unintended pregnancies, and gender-based violence. We plead with our vice chancellors, deans of students, principals to strengthen our reporting channels, set up infrastructures that enable us to acquire adequate education, make our health a priority, provide us with youth-friendly services, treat sexual exploitation and abuse with agents required. Let us build let us bridge the gap between young and the old to create a better world for us, the future generations, remembering that it is our rights, our lives, our future. Thank you.
Good afternoon. Please allow me to stand on the protocol that has already been observed. On behalf of all the students, thank you so much to all the stakeholders, to UNESCO, to the Swiss government, to the governments of the republics of Zambia and Zimbabwe, to the representatives and the vice chancellors from the higher learning institutions. Thank you so much for giving us a seat at the table. We as the students are committed to being actively involved in the implementation of the O3 Plus project because we are the most affected. This project. And this is a wonderful, momentous occasion that what we said we will do to see better institutions, safer institutions, healthier students. Months and months of planning and baseline studies and data collection have culminated into this moment. And for this, we are grateful. These are the faces of the young men and women that you are helping. Thank you for seeing us. We are not the future of our countries. We are the very present. Thank you for investing in the present. Thank you.
Thank you so much, Tinashe and Mwitupa, for those really insightful remarks and continuously reminding us that, this launch is just the beginning. The work is now what starts from here henceforth. Honorable ministers, esteemed colleagues, we heard from Professor Mboa, who made a clerical call to action on this project to ensure that young people and the students themselves, they own the project, and that they are ambassadors on campus and off campus. Dr. Machawira reminded us that contrary to public opinion, students do not have the adequate information and knowledge and the adequate access to services that they need. The students came with a drama and they told us we urgently need to confront negative stereotypes and harmful notions of masculinity in order to address the challenges that we face today, and that men need to be part of the problem, part of the solution and not just part of the problem. We heard from Professor Heising that the program is not just a mere program, it is innovation at best, and that we need innovative ideas in order to accelerate implementation. Honorable Siakalima says if we get it right now, if we get it right from the start, we'll see this program expanding and being scaled up to other universities and other colleges, and making a call to partners to mobilize more resources, because the work in front of us is huge. Mr. Thanofer told us that the failure to provide students with adequate sexuality education increases their likelihood to contract HIV, to experience early and unintended pregnancy, and to engage in harmful and risky behaviors. Our guest speaker, Honorable Professor Mavima, made it very clear and made a very strong case for investing in the education, the health, and the well-being of young people today in order for us to reap the benefits of the demographic dividend. That if we fail to do that, there will be no way that we can reap those benefits. So to achieve the Africa we want, we must invest in these young people. And now, just now, we got reminded again by the two students, Tinashe and Mitupa, on the need to bridge the gap between the services, the education and the services, and to ensure that we provide the best environment for young people to access the right form of education and knowledge and the services. And I like what what Mitupa said at the end, that we're happy that you see us. That's a very powerful phrase, that we do see you. We see you. We see you. On that note, in as much as I would love to continue talking, because I think I'm a politician by nature, I'd like then to really just thank everyone, especially the people that work behind the scenes to make this event a success. Let us give them a round of applause. And thank you very much for hosting us here at the UNZA of Zimbabwe. When we were thinking of where the hosting should happen, obviously, for obvious reasons, you know, I was pushing for Zambia. And, but you've amazed us here in Zimbabwe in the way that you have executed this launch today. Let us give the Zimbabweans a round of applause. And on that note, from me, the son of the soil, Remy Shawa, married with 3 children, in case you are having ideas, and my colleagues, Priska and Susan, the sign language interpreters, would like to thank you all and welcome you to a wonderful lunch. You want to clap for us? Thank you. So in terms of where we're going to have refreshments,